Hi, and welcome to InFocus. This is Jabbar Al-Ubaidi. In this episode, I will be talking with 4 doctors from the continent of Africa. With me in this program.
My name is Dr. Khaone Majimani. I'm a general medical practitioner from Botswana. I currently work at the country's largest referral hospital in the ENT department, but I'm also passionate about issues of sexual reproductive health and rights, especially in girls and women in remote areas. So I volunteer for an NGO that deals with that.
So I'm Samuel Okevinde. I'm a medical doctor, currently having my residency training in public health at the Lagos State University Hospital. I also run a foundation known as Sun Alliance Foundation, a non-for-profit that work to improve access to healthcare, particularly to the underserved population in slum and rural community areas.
My name is Dr. Siham Said Ali. I'm a medical doctor working in healthcare quality improvement. I am a head of quality improvement department at one of the public hospitals in Addis Ababa, Ethiopia.
I'm Dr. Jinembo Esther. I'm a medical doctor in public health. I'm from Cameroon. And I'm currently working with WHO to support countries in Africa to prevent and control non-communicable diseases.
We'll be talking about COVID-19 and the possibility of extending help to their hospitals and medical centers in their countries. And, you know, this could be in terms of raising funds or sending donations or medical supplies and even vaccination and the vaccines. And of course, there are legitimate institutional ways that you can do this, either through NGOs that they work with their institutions in these countries, or directly contact their hospitals. We will put the information there for you on the screen, and also the embassies, their embassies in Washington, D.C., and our embassies, that the U.S. embassies in their countries. Tell us a little bit about the status of, I don't know if we can call it post-COVID, but still we are in the process of getting rid of this virus. How is the situation now and the status there in your country?
Okay, thank you very much. Yeah, thank you. As regard the COVID status, of course, we all know that COVID was unplanned, was unexpected. It's a pandemic that has affected different economy different way. But for my country, Nigeria, of course, we had shut down. However, post-COVID, like you rightly said, we are not over, but a lot of people have really gone back to resuming their life. Vaccination is still going on, definitely, but it's as good as, you know, people are not really giving attention to COVID anymore. Yes, you know, we're not having masks. Things practically are back to normal, and almost all the things that were put in place during COVID, like, of course, hand washing and those things, are not being followed anymore. But overall, I would say that post-COVID, it's been okay. Everything has been back to normal in my country, even though the vaccination is still going on.
Yeah. Thank you. And yeah, what about other countries? Is the same situation, or things are better? Because you want to give a general perspective for our audience, then really our intention is to extend some help as much as we can to your respective countries.
Okay,
So,
let me jump in here. I'll give maybe a general perspective for the African region, given the fact that I'm able to work from that level. I will say generally it's what Dr. Samuel has said. The mortality rates have drastically gone down, even though the infectious rates are still there, but not as it was before. And definitely there are discussions about another wave of the COVID pandemic, which might be coming in the future ahead. But most countries in Africa have resumed their normal lives, and travel restrictions and travel bans have come to an end. And we are mostly focusing on having a universal vaccination and getting everybody vaccinated so that they can be properly prepared for maybe a probable next wave, maybe. But our hope is that we should not get there. But generally, Africa has opened back up, and businesses have come back to normal, even schools as well. Thank you.
Thank you so much. That's good news, very encouraging news. And anyone, Dr. Shaham, you want to just also enlighten us, please?
I would say it's the same for Ethiopia as well. There are so many bans have now been lifted. We are able to take our mask off in open spaces. We're still encouraged to wear a mask inside, especially schools and hospitals and other high-risk places. But travel bans have been lifted. In fact, for now, if you're vaccinated to get into the country, you don't need a PCR test. So there are some improvements. And like Dr. Esther said, there are risks for other strains coming, and there are talks that this can lead to another pandemic. But so far, that people are looking to be positive, and yeah, and it seems like whatever is coming seems milder than before. So yeah, we're trying to stay positive.
That's good. You know, we need to always think positive. How about the hospitals that you're working on? Or they have any shortages they have, or they are, you know, all the what they need is there, especially for the staff and also for your patients?
Okay,
I would say,
I'll go. Oh, sorry. Was that specific for Dr. Sia?
Go ahead.
Okay. Yeah, well, regarding the COVID situation, in my country so far, vaccine rollout has been quite good. There's been drive-through vaccinations. A lot of people have gotten vaccinations, about 60% of the population now. However, before I came here, wearing of masks was still compulsory in public areas, and mainly in the hospitals. Even for admission, for us to admit patients into the hospitals, we still need to do a COVID PCR test. We cannot do any surgical procedures before doing the COVID PCR. So we still isolate COVID PCR positive from negative. And usually the case is that if you are positive, you usually cannot get a surgical procedure done. So what we'd do is would let them isolate. If you are fully vaccinated for 5 days, if you are not fully vaccinated for 10 days, then we can readmit them into the hospital. However, we still have challenges of running out of the PCR test kits, which sometimes then hinders our work in terms of admissions and doing surgical procedures for our patients. And we still run out of personal protective equipment, including masks, gowns, and the like. Yeah.
Okay. Other countries, the same in your, Esther, do you have the same thing in your organization?
Yes, definitely. At the level of organizations, offices, especially government offices, they still try to implement the wearing of masks and the washing of hands, and they also emphasize on the fact that you have to be vaccinated before you can have access maybe to the building and maybe to some other services. So generally at the government level or at private level, at organizational level, we try to implement that, especially at UN organizations. We are actually strict on that. If you don't take the vaccine, you might not be able to come to work and interact with other people, so that other people don't stand the risk of getting infected. But generally on the streets, you won't find people wearing masks. You would find people living their normal lives. So generally those restrictions come at the level of businesses and organizations and governments. Yeah.
Dr. Sam?
Okay, so I would want to agree with Hester that like my own hospital where I work, for everyone coming, whether you're a doctor, patient, a nurse, you definitely have to be on masks because those are high-risk areas. Other than that, when you leave the hospital or you leave the facility, you take off your mask. I must also say that in Nigeria, we are beginning to see a surge, like an increase in the case of COVID-19. And that, of course, that's not unexpected. We still have travels. A lot of countries are already relenting on the travel restriction. So we still have some countries with still have high level of cases like US, for example. And as long as they still travel, people coming from one country to another, we probably will still continue to have the COVID-19. Another perspective is to see that COVID-19 is almost endemic now. I mean, it's going to be with us for a long time. And instead of trying to maybe eradicate it, we need to begin to look at how we can live with it and deal with it as being part of us. Yeah.
So now, Dr. Cham, did you say something about your organization?
Yeah, I would want to say vaccine uptake is pretty low in Ethiopia. I would say 22% of the population has been vaccinated so far, and we come from a population of 110 million. So we are a big country with a lot of population and then not enough vaccines for our big population. That has been a challenge. But we're also seeing some other challenges because we've been focusing on COVID for such a long time, we've kind of forgotten about our other essential care services, such as elective surgery. So we do have a lot of backlog and catching up to do on our essential services, and that also has been a challenge in my country.
Thank you, Dr. Cham, because you really give me a lead for my next question. So if, some of organizations in the United States and around the world, but especially in the United States, they would like to extend some help. How do you see this can be actually facilitated?
Okay, thank you very much. I think it's what they've been doing. There's a need to continue to provide enough vaccines, enough consumables. Of course, like Siam said, we don't have enough consumables. They're not enough. Nigeria also has a high population, like over 200 million people. I believe that less than 50% have been vaccinated. So we need more vaccines. We need more consumables, and also we need basically what they've been doing, the partnership, and we also need to continue to educate the people because we still have this vaccine hesitancy. Some people still believe that the vaccines is still bad, will make you impotent, or will make you not be able to deliver. So we still have a lot of education to do, and if we can get more support in terms of educational materials and the things I've earlier said, I think it will go a long way to improve the vaccination rate in Africa and in Nigeria. Thank you.
Yeah, no, thank you. Is it the same thing with your organization?
Okay. If I step in, I would just say, if in addition to what someone has said, I think the United States can also support the countries by building their capacity. Like what we saw during the COVID, we had to, in some countries, they had to recruit medical doctors in their final year to come and support, because we had a lot of deaths, we had a lot of people who were sick, and so there was shortage of staff. So if the United States can also contribute to build the capacity of our medical and health professionals so that they can be well prepared to handle the patients, to better take care of the patients and train them so that they can be more effective, I think that will go a long way in helping us throughout this pandemic.
So would you say the local hospitals and medical center, and especially in the state of Massachusetts, where you are been staying with Bridgewater State University, you think there is also a possibility for them to offer some help, and because they have medical supplies, they have also vaccines. Is it possible to contact your hospital directly or you directly if that going to happen? Because if you, I mean, the call for the United States government, I think this is a legitimate call, and of course, everybody is in support. I'm sure of that. But at the same time, if we look down and see, these major hospitals around, all the states, I think we would like to make sure that we reach out to them, and then probably they can, donate some of the medical supplies and also vaccines. And so what's the best way to do that, in your opinion, as a medical expert and as doctors?
Okay, for my country, it may not be as easy as being in touch with me or my hospital. So when it comes to huge donations or things that affect the whole country, there's processes and procedures to be followed. So when COVID began, there was a task force that was put in place, and then there was a relief fund team that managed all the donations and funds that were coming both from within the country and outside the country. So I think the best way to facilitate would be through the Ministry of Health. I would need to get more information as to who would be the direct contact person, but there's a lot of red tape and procedures to be followed. Yeah.
So that will come through the ministries, or if there are,
Yes.
the task force committees. But there are some NGOs, right, in your country. Also, there are some NGOs, whether in the United States or in general, and in Massachusetts, that, NGOs with NGOs, they can connect together and then and do some networking, and then also they do, because they know the procedures. And I think what you said makes sense, because then it's not the kind of individual preference, but it becomes institutional, because you are working
Exactly.
with the authority and the medical authority. And so, and the minister, usually the Ministry of Health is one of these, institutions that someone can work with them. But are you aware of some of the NGOs that they are interested to connect with the NGOs here in Massachusetts and in the United States?
Well, currently in my country, actually, my NGO is the only NGO in the country that was allowed to roll out the vaccines, because we're a big NGO. But even that, the procurement was still through the Ministry of Health. So all the supplies were coming through the Ministry of Health. But there were other big institutions, for example, Harvard University. They were able to, because they were doing some studies on the vaccine, they were able to procure on their own somehow. But even with NGOs, it can't be NGO in Botswana to NGO in America communicating. The channel will still need to be through the Ministry of Health.
Okay. Any thoughts from you, other doctors, please?
I think, I think if I may go on, what we could do, if you identify such NGOs in the United States, we could be a link between them and then our Ministry of Health. I personally, my organization can be like a linkage. We reach out to people we know there and let them know what we want to do. And I'm sure they will be willing to accept whatever support, whether technical in form of vaccines or donation. And Nigeria will be willing to accept such donations. We are willing to be the bridge or the linkage between this organization.
Okay.
Thank you.
Yeah.
I also maybe just wanted to step in and say the U.S. embassies in each country, I think that's also a very good channel through which we can be able to send vaccines. So I think they know the procedure, and they're able to liaise with the government. So if they can't communicate with the U.S. embassy, I think the U.S. embassy can guide them on how on the process of sending the vaccines. Okay,
so here we have, for relief funds, probably their organization. I'm looking for my notes, and also there are task forces. Of course, all these connected with the Ministry of Health or any institutional authority in your respective country. And also, it is a good idea actually to connect with our embassies, that's the U.S. embassies in your countries. But at the same time, probably if just, I don't know if you agree to that, we probably, we can also talk to your embassies in Washington, D.C. and see if they can also help us do the networking, because this is, I think, is legitimate, and it's something that we do good by our communities. And since, you know, there is a drastic need, of course, you know, not all the countries, they have the same need, but the need is there. And so we need to work around it in a very faithful way that will benefit the people, because this is a health issue and a public health issue, and I think everybody will help. Any final thoughts on that?
I would like to say that depending on the donation, it depends on the material that is being donated, that it could be donated directly to the organization sometimes, especially like public hospitals, and consumable goods such as masks, gloves, or any other medical equipment can be directly donated to public hospitals or government, like hospitals in need. And there are some things like vaccines that we want to be careful about and have to go through the at a national level.
Cool.
But yes, there are places in a way that you can reach out to organizations or hospitals that are working directly, and there are obviously material needs, and we also want your expertise. So we want to know, we want to learn from you as well. So it doesn't have to be money, it doesn't have to be resource, but we're working on collaborating. We do teach medical students, we do have specialties, so collaborating and working with organizations here would also give us an opportunity to do better in our own setup without, I don't know, maybe you don't have to come, maybe you don't have to go, but in this day and age, the one thing that COVID taught us is that we can do things remotely very well. And so that's definitely an option. So I wanted to remind that.
Well said. Yeah, go ahead.
If I could also add, my organization, for example, work with people in slum and rural communities. So if the organization that are willing to partner with us in the area of research, we also do a lot of outreaches where we take medical supplies to those in the communities and provide free healthcare surgeries. So if the organizations also who are in line with such visions, they can reach out to us and we can partner. That's another way in which we can have a direct partnership between US and Nigeria, basically, through our foundation.
Thank you so much. Any other thoughts?
Let me just step in. And I also just wanted to add that for international organizations, maybe like WHO, UNICEF, or UNAID, they have offices all around the world in Africa. So it's also one of the ways, if you want to send something, maybe you could go to their office here in America, and then you liaise with them, and they'll be able to connect you to their office and the particular country where you want to send for things like masks and hand sanitizers. I think they could go directly through the NGOs, and they are going to send them to the countries for distribution.
Thank you. Well, thank you for your time. And of course, we're going to follow up with you. And I wish you a safe return to your country. Thank you for watching InFocus.